Okay, marketing. Lots to talk about. This week, we're going to talk about video. Should you be doing it? Absolutely. I'm going to make it easy for you. Okay, Dan Brown here from MGE, kind of the resident marketing specialist here. And what are we going to talk about today? Well, video. I've talked about it in the past, but I think there's so much to it that we're going to break it down. What are your next steps? Are you able to do it easily? Do you need to buy a bunch of equipment for it? Well, let's make this super easy from the start. Absolutely not. What's the best camera for video? The one you got in your pocket. We're going to talk about using that, and then where do we use it? So let's get started. Great, so let's start with equipment. Okay, well, your phone is a great piece of equipment. Couple tips on that. If you're going to have one of your team members use it, I would suggest making sure that you have a practice phone. So this is a phone that exists in the practice. It is not a team member's personal phone. And say you don't want your phone being used, well, that's okay too. Have a practice phone. If you have a practice phone, what I want you to do is if you have an iPhone, I'd like you to have an iCloud subscription that automatically backs up all the content every night. And if it's an Android, maybe your Google Drive service. And again, your content is being backed up every night. Why am I saying that? Well, say this phone grows legs and walks out of the practice. Say something happens and it gets damaged. No matter what happens to the device, you have the content. What's going to be the content? Well, we're going to talk about that. But this is not just going to be your video testimonials from patients. It's not going to be just your doctor explainer videos talking about answers to commonly asked questions. It's going to be your before and after photos of your patients for the amazing work you do. So all of that content is going to be housed on this device. Device doesn't need a SIM card, so don't put one in it. Doesn't need to be an amazing device, just relatively a newer one. And I'll give you a couple tips on that too. But let's try to have a centralized device that is the device. It's stored in a very secure location. We all know where to go to get it. We all know where to go to return it. And like I said, if the device somehow goes missing, what I want you to do is know that you've got your content secure. You get a new device, you restore all of the content from the backup, and you're rolling within hours. Okay, so what about using this device? So what should we do? Should we do it in 4K? Should we use this HDR setting? Do you need to know about any of that? No, you don't. You really don't. All you need to know is that every device shoots in what's called high definition, HD. 4K, boy, it's a really, really nice picture. You can zoom in on it and still retain that nice resolution, but it's a big file when you're done. So I do not suggest using 4K video because YouTube doesn't use 4K. It's not available currently. And the file size is so large that when you go to transfer that file onto your computer or to a video editor, boy, it's quite a file to transfer and it takes time. It's costly, etc. I wouldn't go there if I were you. I'd stick to just your normal HD settings. Good. Now, when you're going into video, if you have an iPhone, I want you to right now open up your iPhone. You may be on it right now. Go over to your camera, open it up, and see if you have a selective option of cinematic for an iPhone, cinematic. If you have an Android device, I want you to see if you have what's called Pro Video or Portrait Video. What we're looking for is a blurred background. If you take a look at the background right now, you can see that I am in focus. The background is a little bit blurry. What does that do? It forces you to put attention on the subject. In this case, that's me. For you, when you're getting a patient testimonial, you're going to have the subject there. You're going to go into cinematic or portrait video. And all of a sudden, the background dulls out a little bit, forces the viewers to take a look at the subject and stay looking at the subject. Maybe not the bloody gauze in the background. By the way, remove the bloody gauze out of the background, even if it's blurred out. Take a look at your background, but it doesn't need to be perfect because it's somewhat blurred out. Next point, what about lighting? Well, we are right now in one of the 7 different places where we do video shooting in MGE. Well, we have a 55,000 square foot building. We can afford to do that. We have that much space. You don't. So what I want you to do is I want you to see if you got a window that has natural light that comes in. You want to face that window, meaning you, the subject. If you're doing the video, say you're doing a patient testimonial, I want your back to the window and I want the patient facing the window. Okay, so try to get natural light washing in around that patient's face. If you do need to do artificial lighting, that's acceptable. Don't go spend a bunch of money and have those big, huge lights. You don't need that. There are lots of different solutions, and we actually cover all of those solutions. Quick tips on inexpensive equipment that can have you up and operational with your own little studio. And we cover that all at the MGE New Patient Workshop. Now, this is a very special workshop. It's 2 days. It's live, online, and it's amazing. I highly suggest doing it. I'm one of the speakers. Mr. Jeff Santone is another one. Great data on how to get a bunch of new patients without spending a bunch of money. Okay, so we've talked about what style to shoot in. Again, cinematic on an iPhone, portrait video on an Android, lighting. Let's talk about audio. Audio is actually more important than the video quality. People say, no. It's so important to have, it is important to have good video quality. But I want you to see what happens when the audio changes. Watch this. I'm going to back up here. So now I'm about 10 feet away from the microphone, but was about 10 inches away from the microphone. How's the audio sound right now? And that's with some really high quality audio equipment. Your phone, unfortunately, doesn't have that great of a microphone, and that was still pretty poor. We would never use that in our recording. For you, you can get these Bluetooth microphones that plug into the bottom of your phone, clip it onto the patient's lapel, piece of their clothing, or they could literally be holding it. You've seen it. And if you're asking them questions, you've got one, they've got one. These things come in packs of 2. Again, we cover all the equipment you need at the New Patient Workshop, but worth investing and having high quality audio, it's a must. Okay, so now let's talk about the types of videos. Dan, I've been looking at doing video, really want to do it. Where do I start? Well, I've given you some tips on the equipment and your approach. Now it's time to think about where do we start? Top of that list, patient testimonials. Patient testimonial is that individual's message to other patients, not to you. I want you to get that clear. You're asking a patient, hey, listen, Mr. Jones, we're so happy that you're happy with your treatment and your experience here at ABC Family Dentistry. You know, there's a lot of people out there in our community that are just sitting there concerned about this dental treatment or going to see a dentist. In fact, in our area, we found about 1/3 of our population don't see a dentist routinely. For that reason, we want you to share your experience so that somebody who's sitting there possibly in fear of needles and fear of drills, had a past bad experience, etc., they can hear from an actual patient and make their own decision. Should they give us a try? Should they go see us here at ABC Family Dentistry? You're orienting the patient to not be an ambassador for your practice necessarily, of course they will be, but to be an ambassador for good oral health. And with that, their orientation is talking to the patient out there who's not going to make a decision unless they hear from a patient. Yeah, they're going to read your website. Yes, they're going to look at your Google business profile. Yeah, they're going to check your social media channels out. But what do they want to see and who do they want to hear from? Your patients. That includes your Google reviews, sometimes your Facebook reviews, sometimes your Yelp reviews, and patient testimonials. Good, so what questions are we going to ask them? Well, we've got a whole list of the questions, and these are different based off the treatment. Say it's just everyday restorative. Well, we've got a list of questions to ask a patient during a patient testimonial for restorative work. We have a whole list of questions for larger cases, such as dental implants, all-on-4 cases, FMR, full mouth rehabilitation. We have a whole list of questions for if it was a cosmetic case. So these different questions vary, but very slightly. They vary, but very slightly, okay? So the basis of your questions are, generally ask a question like this. Mr. Jones, how did you find out about us here at ABC Family Dentistry? Why are we asking that question? Well, first of all, it's very good for you to know how they found out about you if you haven't asked already. Second, it's allowing that patient to feel relaxed and comfortable. Initially, when they look into a camera, look at me, they might look like this. Hello, my name is Ralph Jones. I'm a patient here at ABC Family Dentistry. And you just maybe have to ask them a couple more questions. You're going to see their shoulders drop. You're going to see them start to relax. They might start using their hands, which is good. You want them to. You want them to be very natural, just like I'm doing with you right now, moving all over the place. That's okay. It's called natural. It's called organic. Your patients really appreciate it. They don't necessarily want the professional video shoot that you see with corporate dentistry with actual paid actors, not actual patients. So your potential patients here in family dentistry, they want to see somebody who's just being themselves. So once you see that they're relaxed, you're on the other side of how did you find out about us? Where do you live? Now they're relaxed. Great. So Dr. Jones, tell us about your experience here with ABC Family Dentistry. Ask that question and then shush, zip, let them talk. You can do this behind the camera. That's totally okay. But I don't want, yeah, none of that. None of that. Let the patient speak. Why? Because we're going to probably edit out everything you said and asked and just have the patient's story. Remember, your prospective new patients, they don't want to hear from you. They want to hear from your patients. We're going to go through the other list of questions, again, all available and part of the new patient workshop. But then at the end of that, so Mr. Jones, what would you tell another patient who's sitting out there, maybe worried, concerned, they've had a past bad experience about ABC Family Dentistry? Again, let Mr. Jones say, well, if there's somebody else out there like I was hesitant, I had a past bad experience, this and that. Here at ABC Family Dentistry, boom, golden nuggets. Okay, we're going to take that. At the end of every statement by the patient, we give just a little bit of a pause before we ask the next question and acknowledge them. So that's why I chose ABC Family Dentistry. Pause. Thank you very much, Mr. Jones. That's amazing. I'm so happy to hear that. Why did we do that pause? Well, we're giving a video editor, might be one of your team members who you're pretty good with TikTok and Instagram and Facebook Reels, and they know how to use this app called CapCut. It's free, it's easy. Or a professional video editor that is possibly your patient you're doing some barter trade work with, or a professional video editor that you hire out. That video editor is going to use cuts and move things around, not change the message, but maybe we don't want to hear that patient came in and brought cookies and how much they love Sheila. And we love Sheila too, and we love cookies, but that might not be in the final cut for your testimonial. Once we have that, now we're going to take that file and we're going to get that file to the person who's going to edit that video. And video editing, well, we've got resources. We have teams of editors that do this for our clients all the time. It's pennies. It's pennies to get this done. We literally had one of our clients shoot one of the roughest testimonial videos I've ever seen. The editor did their best job to clean it up. The doctor said, should I post it? I said, you absolutely should post it. Video, doctor, is like pizza. Even when it's bad, it's still pretty good. And the doctor said, well, Dan, I'm going to trust you. Posted it, uploaded it to his Google business page. Saw me 6 months later and said, Dan, we have actually calculated the number of people who've referenced that video as to why they walked into our practice. And we've tallied how much we have invoiced, charged out for the services for the people that did say that. In 6 months, he was at $120,000 of return on investment for a video that was shot on a smartphone and edited for $300. So, testimonials, top of the list. Where are we going to go from there? Well, anything that's a fun message. What we always suggest is that our clients do, and they schedule this, one TikTok type, Instagram type, Facebook Reels type video every week. Now, doctor, I'm not trying to turn you into the dancing dentist. I'm not going there. I'm not that person. And if you're not that person, I don't want you to be that person. I don't want you to be anything you are not. But let your team get their creative juices going. Let them have some fun. Put it in the schedule. 30 minutes a week is the time that they have to come together. They built an idea through the week. They come up with bright ideas. You take a look at it before it goes out. There's no unauthorized posting of videos, right? And things that might not be the right color and flavor for your practice. But let them have some fun with it. Have them look up other dental trends. You'll see some fun stuff out there. It's a great team building activity, and it really shows the internal culture of your team. You might also want to just feature one of your patients, some of their great accomplishments. This is Johnny. He just got a full ride scholarship to XYZ University. Talk about it. Interview Johnny. Get his thoughts about, his future and stuff. What does that have to do with dentistry? Not really anything at all. What does it have to do with family dentistry? Oh, everything. Let's talk to Johnny. Let's talk about this individual who's got a house painting company. Let's talk about this individual who's got a successful, electrical company and is the local servicing company, right? Small, privately owned business. Sound familiar, doctor? Small, privately owned business. Talk about your community. Feature them. Social media goes wrong here. People think it's about me, my selfie, hey, right? That's where it goes wrong. Social media isn't me media, it's social media. So be social, be interested in your team. Hey, 7-year anniversary with my office manager, featuring her, throwing a few, video clips and some of their family photos and the great things that your office manager does. Create a little video about that. Make it about other people. Yeah, you can salt in some video messages about your practice, special offers, etc. But let's make it about the practice and your community. As you can probably see, I could go on for hours. And in fact, I do thoroughly and necessarily at the MGE New Patient Workshop. I know I've mentioned that a couple of times. I'm not trying to pitch it because we need you there and it's some big commercial here. I'm telling you this because it's such a powerful 2-day workshop that we're so confident with it, we give a money back guarantee up to 6 months after you've attended the workshop. So I highly suggest going there. My paycheck doesn't change whether you do or you don't. I'm just letting you know it's a great workshop and there's like 5,000 dentists that would say the same thing. Good, so those are some tips. It might be too much. That's a lot of data. And I understand that. I didn't mean to overwhelm or confuse you. But if you found some value in this, I wouldn't mind it if you'd leave a comment as to, yes, this was valuable. Thank you. And anything else, as far as questions you have, put those in the comments. We're going to answer those, not just for you, but for everybody else. So we're very interested in what questions does this stir up. And I'm doing a whole series on marketing tips like this. So if you want to see those, go ahead, click the subscribe button and make sure you enable all notifications. And with that, until the next marketing tip, that concludes this one, and we'll